In this video, we're going to talk about one of the leading, most popular, most talked about treatments for hair loss, and that's topical minoxidil. Hey guys, I'm Dr. Laura Soong, and welcome to my channel where I talk about all things in the world of dermatology. If you're new here, feel free to hit that subscribe button so you don't miss any of my future videos, and the notification bell so you know when a new one is released. So let's dive right into it. Let's talk about some common questions I get about topical minoxidil. So minoxidil is a medication that was first developed as a blood pressure medication, but they discovered it has this interesting side effect in that it helps to grow hair. And so they made it into a foam and a solution that we can apply to our scalps to help grow hair. Now, we're not exactly sure how topical minoxidil works to grow the hair, but we think it works in two main ways. So the first is that we think it increased blood flow to the scalp. The more blood flow you have to the hair follicles, the more likely you're going to have more oxygen and nutrients feeding those hairs so that they can grow. And the second way that we think it works is it seems to push the hairs into the growing phase or the anagen phase and prolongs that phase. So, most of the time we have 85% to 90% of the hairs on our head in the growing phase and maybe 10 to 15% that are resting and destined to be shed. It pushes more hairs into that growth phase so you have more thick hair, more hair on your head. Now, there's one other thing that we think it does, particularly in people that struggle with female or male pattern hair loss or something called androgenetic alopecia. In that condition specifically, we notice that a lot of the hairs start to shrink down or do something called miniaturize. And with topical minoxidil in patients with this condition in particular, it seems to increase the thickness of the hair. So instead of them miniaturizing, it helps to build up the thickness again so that you see less scalp, more hair. So the great thing about topical minoxidil is you can buy it over the counter and start using it at home whenever you want. It's best used on dry hair on a clean scalp. I usually recommend if you wash your hair in the morning to put it on overnight and leave it on overnight. The best way to do it for men is to apply it by flipping the canister upside down. I usually recommend using the 5% foam and spraying it directly on the areas where you're noticing the thinning, so often here and at the back, and then massaging it in well and making sure you let it dry before you go to sleep. For women, it may be a little bit more tedious, so we have a little bit more hair, so it's important to part the hair and apply the foam directly on the part line and then to do it in sections. So you may want to part the hair in two different places, apply the foam along those areas, and massage it in well. So topical minoxidil comes in two different strengths over the counter. There's 5% foam and the 2% usually solution. I usually recommend just going big or go home, right? So just go for the 5% foam. It does have better studies to show that it works better. You can use minoxidil anywhere from once to twice a day. I find the most important part of using topical minoxidil is being consistent. So if that means doing it once a day consistently is easier than trying at the beginning to do it twice a day and trying to make that into your routine, then I'd recommend just start with once a day and get used to having that as part of your hair care, skincare routine. If you're finding that it's just not working fast enough and you want to step it up, then sure, go to twice a day. That's no problem. So once you've applied it, it's really important to wash your hands well, because if you have the residue still on your hands, or if you let it drip a little bit and you touch certain areas, wherever you apply the topical minoxidil, it has the risk of growing extra hair in unwanted areas. So again, make sure you don't get it onto the forehead or, on the cheeks, and wash your hands off well so you don't touch other areas and stimulate hair growth in those places. Now, the other great thing is you can use topical minoxidil to grow hair in other hair-bearing areas that you may want to accentuate. So, everybody right now wants nice big eyebrows. For women or men, you can use topical minoxidil in those places too. So I recommend getting a spoolie brush or a small toothbrush, applying the medicine on the bristles, and then just rubbing it on the eyebrow area. You can also use this for the beard. So either with your fingers or with a toothbrush, massaging it into the beard area to try to even out any patchiness some people might be experiencing. Now, here's the thing. Before you start topical minoxidil, it's important to know that it doesn't work for necessarily everyone. If you have quite advanced hair loss already, for example, if you're a man struggling with male pattern balding, if you're already bald, then it's unlikely going to help. If you're dealing with very early male pattern thinning, so a little bit at the temples, a little bit at the back, then the earlier you intervene, the more likely you're going to get a successful result. The other thing to know about is that minoxidil does rely a little bit on your genetics. So there is an enzyme in the scalp called sulfotransferase, and this enzyme is very important for converting minoxidil into something called minoxidil sulfate, and that is the active version of the drug. And so if you have a low amount or you're deficient in this sulfotransferase enzyme, you're not necessarily able to convert as much of the drug into the active form, and you may not get much benefit. So based on studies, we think that minoxidil helps about 2/3 of people, but there is about 1/3 of people where they may get a less robust response or minimal improvement. The great thing about topical minoxidil is most people tolerate it really well, but there are a few things that you need to know about in terms of side effects. So with anything that you're putting on the scalp or on the skin, there is always a risk that you're going to get some irritation. It may dry out your skin on the scalp. Some people get allergic reactions to something in the product or the medicine itself. The other thing to know about is that some people can get more internal side effects, especially if you're using too much of it or if you're just really sensitive. So some people might notice headaches. You could get low blood pressure symptoms like dizziness, sometimes even palpitations. If you're getting those types of symptoms, then it's best just to back off and stop the medication. It's important to know that you can't use this medicine either if you're pregnant or breastfeeding. Now, here's an important thing you need to know if you're a pet owner for dogs or cats, okay? So minoxidil is actually really toxic to cats and dogs. Even if they eat or lick a small amount of the medication, it could potentially be lethal. And there's actually reports of this happening in the literature. So for example, a cat licked it off their owner's hand, or the owner decided to put the medicine on their cats and dogs to stimulate their hair growth. There's some reports where animals died from that. Or if dogs get into the garbage can after you throw out the medicine and they eat the bottle, they could potentially have side effects from that. So what I recommend is always wash your hands really well after you apply it to your scalp and avoid touching your pets right afterwards. Store the medication in a hard to reach area. So for example, in a bathroom cupboard, not just sitting on the counter, especially if you have animals that are very exploratory and looking for stuff to play with. Always, if you throw the can out in the garbage can, take it outside, put it in the garbage can outdoors so your dog can't get at it. And if you sleep with your animals, then you may want to consider wearing a hair bonnet or something that covers your head so they can't lick your scalp, or even consider using the oral version of the medication so you just don't have to worry about these things. Now, one other thing you should be aware of when you first start using the medicine, which isn't really a side effect, but a lot of people kind of freak out about, is when you start using the medication, because it is pushing your hairs into the growth phase, it kind of kicks out all the lazy hairs that are just sitting there waiting to be shed. And so we talk about this kind of dreaded minoxidil shed. And so a lot of people notice quite significant hair shedding in the first 4 to 6 weeks of use. This is not something to freak out about. It's not a reason to stop the medication. It actually is a good sign because it means it's working. So stick with it, push through, and then you'll start to notice the benefits. Now, in terms of when you're going to see the benefits of this medication, it is a bit of a long haul. So hair in general, whatever treatment you're using to try to stimulate your hair growth, it's going to take time because hair grows very slow, only about 1 centimeter a month. And so you're going to want to wait at least 6 to 9 months before you make a judgment call if it's working or not. I usually tell people to take progress photos on their phone before they start the medication at the 3-month mark, 6 months, 9 months, etc. Now, a lot of people come to me in clinic and they're like, well, I don't know if I want to start using it because then that means I have to use it for the rest of my life. And yes, for some people that is true. So if you're struggling with a chronic progressive type of hair loss, for example, female or male pattern hair loss, you're going to have to keep using it to maintain the benefit if you notice an improvement using it. But there are some other types of hair loss. So for example, alopecia areata, which is an autoimmune type of hair loss, or something called telogen effluvium or postpartum hair loss, which tends to happen with stress. Those are both typically more transient and can recover. And so if you're using topical minoxidil for those conditions, the hair loss slows down, you recover, you're not necessarily committed to using this product for the rest of your life. Well, guys, that's it. Thanks for watching. That's just a little summary of some of the common questions I get about topical minoxidil. If you have any other questions, feel free to drop them in the comment section down below. If you need a tutorial about how to use this medication, I'm happy to do that. Just let me know and I can definitely throw that up. And stay tuned for more videos about hair loss. We'll see you in the next one.